we're going to get started. Welcome to the WPS Military and Veterans Health webinar on the TRICARE Select Health Plan. If you have questions as we go through the webinar today, please feel free to enter your questions into the chat. We have someone who might be able to answer them for you. Starting January 1, 2018, you may notice some changes to your TRICARE benefits. But the TRICARE plan you have, these following things will remain the same. TRICARE will continue to offer several different health plans. Plans meet or exceed the requirements for minimum essential coverage under the Affordable Care Act. Plan ability depends on who you are and where you live. The affected will include TRICARE Prime, Prime Remote, Prime Overseas, Prime Overseas Remote, TRICARE Standard and Extra, TRICARE Standard Overseas, which is now already called Select and Select Overseas, TRICARE Select, TRICARE Retired Reserve, TRICARE Young Adult, and the Continued Healthcare Benefit Program. Plans will not be affected by the January 1st change are TRICARE for Life or TFL. TFL beneficiary who is not a prime enrollee, services received on or after January 1st shall have the TRICARE Standard or Extra costs applied as if TRICARE Standard or Extra were still being implemented. Other plans that are not affected are the U.S. Family Health Plan, Dental Program, and TRICARE Retiree Dental Program. Which is coming that are applicable to all plans are the benefit plan year will be transitioned from the fiscal year period to a calendar year period. Beginning October 1, 2017, payments that normally count towards catastrophic caps and deductibles will count through December 31st, 2017. Those who reach their fiscal year 2017 catastrophic caps will not additional out-of-pocket costs for authorized TRICARE covered services for the 3 months of the calendar year of 2017. So under TRICARE for Life, TRICARE replaces TRICARE Standard and Extra on January 1, 2018. Select is a preferred provider or PPO style plan that will allow beneficiaries to use network providers with reduced out-of-pocket costs, civilian network providers, and military treatment facilities or MTFs where space is available. With Select, there are no restrictions on choice of healthcare providers. There are decreases in coverage. Enrollment is required for TRICARE Select, but there's no assignment to a primary care manager or PCM. Areas already covered under TRICARE and Standard will be auto-enrolled in TRICARE Select on January 1, 2018. New duty family members will be auto-enrolled into Select if they live outside of a prime service area or overseas. They will be enrolled in Prime if they live inside a prime service area. Active duty service members are automatically enrolled in TRICARE Prime. The National Defense Authorization Act, or NDAA, split beneficiaries of the new contract into two groups. Group A includes enrollees whose sponsor first joined the military before January 1, 2018. B includes enrollees whose sponsors first joined the military on or after January 1, 2018. These will have different out-of-pocket costs. The Healthcare Benefit Program, or CHCBP, offers healthcare coverage for 18 to 36 months or longer for qualified spouses after care eligibility or premium-based plan coverage ends. Healthcare Select benefits at Group B rates appropriate to the sponsor's status. Life, or TFL, provides wraparound medical coverage to beneficiaries eligible for Medicare and TRICARE who generally must pay for Medicare Part B. Retired Reserve, or TRR, members may purchase TRR for themselves and eligible family members. It offers TRICARE Select benefits at Group B rates as appropriate to the sponsor status. Select, or TRS, must buy selected reserve members for themselves and eligible family members. It offers TRICARE Select benefits at Group B rates as appropriate to the sponsor status. Young adult extends TRICARE to certain former dependent children under the age of 26 who lose TRICARE eligibility due to age, typically 21, but up to 23 for full-time students. It offers TRICARE Prime or TRICARE Select benefits at Group B rates as appropriate to the sponsor status. The fiscal year 2017 enrollment period ended on September 30th. The transition period from October 1 through December 31 for both existing and new Prime enrollees. Prime enrollment fees will be prorated for this period at 1/4 the 2017 fee. Enrollment fees paid during the transition period will apply to the catastrophic cap end December 31, 2017. All payments will continue to be paid automatically continuing into 2018. Prime enrollment will automatically roll over into 2018. Enrolling in Prime during the transition period will have a different start date and fees depending on their enrollment date. The 20th of the month rule applies to the following situations. Enrollments between October 1 and November 20th will either have a November 1st or December 1st start date and will be billed at the T3 enrollment rate for the November and December period and new 2018 rate for January 2018. And November 21 or later will have a start date of January 1, 2018 and will be billed at the new 2018 rate. Except to the 20th of the month rule include those who enroll after December 1 and those who enroll after December 21 and through December 31 will have a January 1 start date instead of February start date. Will be billed at the new 2018 rate. The 20th of the month rule will apply to either Select or Prime in 2018 and beyond. The required enrollment freeze from December 1 through December 23, 2017. Freeze, new requests, piece changes, portability changes, and other related transactions and requests will be delayed, but will be captured separately to be added after the freeze is lifted. Note to all enrollments and changes will be entered in TIP Beneficiary 360 under the Enrollment Notes tab to help with beneficiary or provider questions. Requested during the freeze will be effective the date of the request. Continue to be processed and, where appropriate, reprocessed after the freeze. Referral will also continue to be processed. Referral associates will have the visibility in TIP to all enrollment notes, including TRS and TRR. Note, the dates we've given are tentative. Those enrolling for the first time on January 1, 2018 and after must actively enroll in TRICARE Select or TRICARE Prime in order to be covered in TRICARE, include the TRICARE Retail Pharmacy and Mail Order Pharmacy programs. Lack of enrollment means beneficiaries can receive care only at a military clinic or hospital and on a space available basis. Exceptions include active duty members and TRICARE for Life beneficiaries. For 2018, Beneficiaries may enroll or disenroll in TRICARE health care plans at will during the grace period between January 1 and December 31. If beneficiaries are not enrolled in a TRICARE health care plan and then receive care from civilian network providers, they will have the first episode of care covered by TRICARE and be given an opportunity to enroll or re-enroll. Beneficiaries who don't enroll at that time will be responsible for all subsequent costs. TRICARE will not pay on any other claims. For 19, beneficiaries may enroll or disenroll in TRICARE health plans at will during an enroll. For 19, enrollment will occur during an open season period beginning in 2019 based on the calendar year. Open will run from November 12th through December 10th in 2018. During open season, eligible beneficiaries can enroll in and change their TRICARE Prime or TRICARE Select coverage. If an enrolled beneficiary does nothing during this period, they will remain enrolled in their current TRICARE Prime or Select program for the next calendar year and otherwise terminated. An invoice will be effective for the entire plan year with the exception of certain qualifying life events, or QLEs. Examples of qualifying life events include marriage, divorce, or annulment, birth, adoption of a child, placement of a child by a court in a member's home, and sponsor status that results in ineligibility to continue existing TRICARE coverage, loss of eligibility that results in ineligibility to continue existing TRICARE coverage due to age, Medicare eligibility, relocation to a new country, region, or zip code, loss of other health insurance, or OHI, death sponsor, a spouse or child, and eligibility status of any single family member in another family, for example, joining service member. Enrollment must be within 90 days of the date of the qualifying life event. Coverage only as of the first date of the QLE. Enrollment fees must be paid for that period. Next is a move or relocation qualifying life event. The receipt rather than the effective date of the move is the exception. A life event for one beneficiary in a sponsor's family permits a change in the sponsor's or other family's enrollment status during the qualifying life event period. In years, newborns and adoptees will be shared for up to the first 90 days of life as TRICARE Prime if one or more family members, including active duty service members, are enrolled in Prime. Otherwise, the claim will be cost-shared as TRICARE Select for up to the first 90 days of life. If overseas, please note the time frame is up to the first 120 days of life. Different TRICARE plan, parents will have up to 90 days from the birth or court order to change. After days, parents must wait until another qualifying life event or until the open enrollment season to a child in a TRICARE plan or in a different TRICARE plan. If not enrolled in a health plan within 90 days, care will be allowed only on a space available basis at a military treatment facility and will not be eligible for network or mail order pharmacy coverage. January 1, 2018, you will be in one of two categories based on when you or your sponsor entered active duty. Will have different enrollment fees and out-of-pocket costs. Group A includes enrollees whose sponsor first joined the military before January 1, 2018. Group B includes enrollees whose sponsor first joined the military on or after January 1, 2018. Effective January 1, 2018, enrollees in TRICARE Reserve Select, TRICARE Retired Reserve, TRICARE Young Adult, and the Continued Healthcare Benefit Plan have Group B cost shares, regardless of when the sponsor first joined the military. Enrollees, costs for TRICARE benefits will be charged by calendar year instead of fiscal year. In a plan that requires enrollment fees, you will need to continue paying them between October 1 and December 31, 2017. Enrollments will be prorated based on the 2017 rates. You will for the amount owed for the final 3 months of the year. For details on cost changes, please visit tricare.mil/changes and select your TRICARE plan. If you have a premium-based plan, you will continue to see your premiums adjusted on January 1 each year as they have been in the past. TRICARE Life is not a premium-based plan. These are required by law and will be calculated the same way they currently are. These plans include Young Adults, TRICARE Retired Reserve, TRICARE Select, and the Continued Healthcare Benefit Program. Won't change for TRICARE for Life. The changes in TFL eligibility, benefits, or the requirement to have Medicare Parts A or B. For the beneficiary who is not a prime enrollee, services received on or after January 1, 2018 shall have the TRICARE Standard or Extra cost applied as if TRICARE and Standard were still being implemented. You continue to use TRICARE in overseas areas. In some areas, TRICARE will build a preferred provider network. In other areas, you will the network cost share amounts for TRICARE Select. If you buy allotment, enrollment fees will continue to be paid automatically. It will not need to do anything. Note, TRICARE for Life does not pay enrollment fees. Unless your allotment, we will continue to deduct enrollment fees starting January 1, 2018. Electronic fund transfer and in an area where a new contractor will be delivering services, the new contractor will send you information on how to update your payment. Cover services that are medically necessary, which means services that are appropriate, reasonable, adequate for your condition, and proven. January 1, 2018, TRICARE will cover more services, including medically necessary food and vitamins, extended coverage for certain members of the National Guard and Reserve dependents during certain disaster response duty, eligibility of certain enrollees for participation in Federal Employee Dental and Vision Insurance Program beginning in 2019. Current TRICARE covers formulas and vitamins for enrollees with metabolic disorders such as inborn errors of metabolism, medical conditions of malabsorption, pathologies of the alimentary or gastrointestinal tract, neurological or physical conditions. January 1, 2018, TRICARE will begin cover routine modified food, amino acid preparation products for dietary management of individuals with limited or impaired capacity, medical supervision, and a prescription, among other criteria, are required. In teen, you will have even greater access to care. At military hospitals and clinics, this will include more appointments, especially after work or school, more clinics opening at facilities with high demand and volume, faculty care appointing once you get a referral for care, and a streamlined process for getting network referred appointment results. In addition, we will partner with designated network urgent care clinics to provide integrated, seamless access to care. TRICARE brings together military hospitals and clinics with a network of civilian healthcare providers to offer medical plans, dental programs, and pharmacy benefits. To experience, we are also improving integration between military and civilian providers. Processing referrals electronically improves communication among providers. There will be an easier and quicker referral process. There will be faster access to specialty care, and there will be less paperwork to process referrals. More data across the military health system improves your access to care, improves healthcare coordination, will have more access to your health records, and you will be able to get real-time access to data on medical management and utilization. Use of analytics and standardized metrics results in fewer gaps in your care, improved clinical quality, improved patient safety, and comparison between military and civilian hospitals and clinics. The use of telehealth services at military hospitals, military clinics, and civilian healthcare providers. The use of health services, including mobile health applications, is intended to improve your access to care, perform health assessments, provide your diagnosis, intervention, and supervision, monitor your individual health outcomes, improve communication between you and your doctor, and reduce your healthcare costs. TRICARE covers telehealth services the same way as in-person visits. For more information, a recorded webinar on the telehealth telemedicine topic is available on TRICAREforyou.com in the webinars section. The upcoming changes, you can update your information in DEERS. Check your current information, including address, email address, and your phone number. Update information, including significant life events, activations, retirement, separation, having or adopting a baby, getting married or divorced, and so on. You can for TRICARE benefits updates. And if it's electronic payment, update your payment information. Note that if you make any payment information updates, you will be contacted by your regional contractor. New provider directories are available. You'll be notified by your regional contractor if you're being assigned a new primary care manager beginning January 1, 2018. The change only impacts TRICARE for Life patients who are under 65 and enrolled in Prime. New directors' call centers for the East and West are open for enrollment questions. Processing of new enrollments will be delayed during December as the files are transferred to the new regional contractor. First Region enrollment help and information on or after November 20, 2017, region-specific support and information on and after January 1, 2018, you can visit www.tricare-east.com. You can call 1-800-444-5445 Monday through Friday, 8 a.m. to 6 p.m. member time. Region enrollment assistance and information on or after November 20th, 2017, and for region-specific support and information on and after January 1, 2018, you can visit www.tricare-west.com, or you can call 1-844-866-WEST. For additional information about anything that we've covered in today's webinar, please feel free to contact us toll-free at 866-773-0404 or our website at TRICAREforyou.com. Thank you for joining us for today's webinar on the TRICARE Select Health Plan. A recording of this webinar will be available for viewing on our website, TRICAREforyou.com, within the next few days. Good afternoon.